Hello everyone, welcome back to my YouTube channel. It's Veronica here again. Today I'm going to present about the causes, complications and treatment or the management of schizophrenia. What are these causes of schizophrenia? The exact cause of schizophrenia is unknown, but there are those factors which predispose to schizophrenia. One of the factors is genetic factors. Schizophrenia runs with family. If there is an history of schizophrenia in a family, there tends to continue with the family. Another factor is the brain chemistry. When the brain is not producing neurotransmitters well, you find some people tend to get into psychosis. Another one is the brain abnormality, the structure of the brain. Some of the kids or children are born with brain defects. Those ones, they also can predispose to it. Another one, they are environmental factors like viral infections. Another one, like you are exposed to toxins. Those are the kind of the environmental factors I'm talking about. Another one, they are substance abuse. You abuse alcohol or marijuana. Marijuana is one of the most cause of psychosis or schizophrenia in young. Another cause is some pregnancies, all birth complication or birth defects, all birth like malnutrition can lead to this condition. Now the complication. Which are these complications? I said if schizophrenia is not treated early, it leads to some complications and which are not good. One of them is suicidal attempts or suicidal thoughts. Those are one of the complications which are caused by schizophrenia. Another complication, they are anxiety disorders like obsessive compulsive disorder. It is a complication of schizophrenia. Another one is depression. Schizophrenia can lead to depression. It progresses to depression. Also drug abuse. Now if you depend mostly on marijuana, you start becoming abusive. You take it badly. Another thing is an ability to work or attend school appropriately because you're sick. Another one is isolation. You are isolated from the family, social, friends. Another complication is health and medical problems. We have being victimized and discriminated by your fellows and your friends. Another one is aggressive behavior, which like you are violent to people or you can cause harm to yourself. Those are the few complications of schizophrenia. Now, how are we going to manage schizophrenia? Management as support to the schizophrenic patient. There are a range of effective care for schizophrenic patients in our society, in our healthcare sectors. One of the support or one of the management is medication. Medication, you get them from the hospital, from psychiatric clinic. That's where you can get all those medication. Now there are those management that you can manage this patient as here in the society, like psychoeducation. Psychoeducation about mental health. Let these patients understand what is mental health. Let them know what is required of them. They also need our support and they need to be validated. That is what I mean by psychoeducation. Another one is the family intervention. This one is to resolve disputes and empower this patient in our family. Another one is there is cognitive behavior therapy. What do I mean? These are talks. How you talk to this patient. You focus mostly on replacing the negative thoughts. Those distorted thoughts, you talk on displacing with them with positive thoughts. That is what I mean by therapy. It's just a talk. Cognitive therapy is just talking to this patient. There is also psychosocial rehabilitation. Here you will train them, will give them life skills. They also have trainings in those areas, and this will occupy their mind, and they will learn some things new in those places. Another one is support group. Support group, this is where you get people with the same condition, and let them, you start counseling them as a group. That is what I mean support group, as there are people who will support these patients in their condition, in their medication, in their life-to-day activity. There is also behavioral therapy. It is modifying harmful behavior with the good behavior. Let them know that what they are doing is wrong. Because these people, we have said they are not in their sound mind. Maybe this person thinks beating people is normal according to what their brain is telling them, but it's not good. Just train them on the behavioral therapy slowly by slowly, and they will catch up. We have the group psychotherapy. Therapists work with clients as a group, not one-on-one. Not just coming to this person because he has this condition one by one. You just get all of them, and then the therapist combine them and then talk to them as a group. Those are some of the management and supportive therapy of our patients. So I hope you have got something from that discussion that we have to yet today, and thank you very much for listening to me. Bye.